Hi, good morning, Sarah. How are you doing today?
Good morning, Dr. Mitchell. Every day is getting better. Thank you.
So, when you made the appointment with our receptionist, it sounded like you were looking for a way to help you with continuing your path to sobriety. Can you tell me a little more about that?
I just was struggling with everything. I enjoyed getting intoxicated and I have a lot of fun going out with my friends, and it's nice to kind of let loose, but I also feel like I have to deal with the fallout the next morning and the embarrassment with, like the texts I send out to people and the snaps that I send on Snapchat, and I just don't really want to feel embarrassed anymore. I feel like I can learn to hang with my friends and have fun without alcohol, but I still crave it all the time. So I wanted to see if there was anything that can help with that.
I know it's hard to make these lifestyle changes, and I'm glad you reached out for help. There is a drug that came to mind while you were talking that may be what you are looking for. Its brand name is Revia, generically called naltrexone, and it can be used to help you obtain your goal long term. It's just a pill that you will take once a day, and it is pretty affordable, about $54 for a month's supply. Is this something you may be interested in?
I mean, it sounds good, but how exactly is it going to help me?
The medication just helps with decreasing some of the desire by affecting some of your central nervous system receptors, specifically the opioid receptors. So, it is targeting some of the physical aspects versus mental aspects. That being said, since this medication is for the physical parts of addiction, it is also recommended that you follow up with individual or group therapy to address the psychological parts of the alcohol addiction.
Yeah, that sounds exactly like what I was looking for. I would like to give that a try.
Perfect! I will write up a prescription for you. I wanted to also follow up with you and let you know that you aren't alone, and this is a big step. Just in our state of Nebraska, there is a study that showed 22.7% of Nebraskans binge drank during the year 2011 and has caused 422 deaths in Nebraska in the last year, along with thousands of injuries and arrests. So coming to me and admitting that you have a problem was a difficult step, and we can work through this together.
Thank you.
So, let's talk about some of the side effects you may see when taking this medication. Since it is designed to affect the brain, you may feel effects on that system, much like what you see when you are hungover, such as weakness, tiredness, anxiety, irritability, lightheadedness. Some people may have sexual difficulties such as decreased sex drive or difficulty having an orgasm, and in some cases there may be some toxicity in the liver. How long would you say you have been alcohol-free for?
I haven't had any alcohol for about, I think it's 4 days now.
Okay, so with this drug, we would like you to be alcohol-free for at least 7 days to prevent complications. So it is Monday today. Let's plan on you starting the medication on Friday. I'm going to start you on 25 milligrams once daily, and depending on how you tolerate that, we will bump up to the maintenance dose of 50 milligrams.
That sounds good. That gives me time to go to my pharmacy and talk to my family about it.
I just wanted to add that it's very important that you don't drink while on this medication, as there can be some serious side effects when taken with alcohol. With all that being said, please reach out to our office if you are feeling any side effects of this medication like we mentioned earlier. I especially want you to be aware of your mental health and reach out if you have any moments of suicidal ideation. If possible, I would like you to discuss this with the people who live with you so they can be watchful of any change in your behavior and be open to talking with them about your thoughts and feelings. If this drug is causing suicidal thoughts, come back and we will prescribe something else to help you with sobriety.
Yeah, my mom has been very supportive in helping me with wanting to be healthier, so I can talk to her about it and we can watch for this. It's not something I usually have a problem with, but I'm nervous about all the side effects. You said something about therapy while using this drug?
Okay, I'm going to send you a list of therapists and community alcoholic dependence groups that I recommend in an email to you. This medication should be used at the same time as therapy, so please follow up with this. I will need to begin with a urinalysis and a blood draw just to check to make sure that your body is clear of substances that could cause serious side effects, and the blood draw will tell us if your liver is healthy and can tolerate this medicine. Once we finish our Zoom call, would it be possible for you to stop by the office sometime today so we can collect that quick, and then you would be free to go?
Yes, I think that will be okay.
Okay, perfect. Is there anything else you want to talk about, or do you have any other questions at this time?
No, I feel okay with this.
Okay, I am happy to hear that. If you could please reach out to the office and make an appointment 4 months from now to check in, that would be great. And depending on how everything is going, we will look at adjusting the maintenance dose.
Okay.
Alrighty, I will see you next month. Have a great rest of your day and good luck. Don't forget to call if you have any questions or need anything.
You too. See you next month.